Namaskar, I am Dr. Dheeraj Kapoor, Chief of Endocrinology at Artemis Hospitals, Gurugram. Today, let's talk about family and diabetes. There are two aspects which I divided into. Number one, if someone has diabetes, what should the family do for themselves? And if someone has diabetes, what should the family do for the patient who has diabetes? And the answer is common. So, Asians are prone to diabetes, Southeast Asians are all the more prone, and amongst them Indians are the most vulnerable class of people. Which means that by default, all of us are prone to diabetes, family member yes or family member no. So, what should you do? If someone has diabetes in your family, type 2 diabetes I'm talking about, you yourself should show restraint on diet. You yourself should exercise. Why? Because you are prone to diabetes. That is one aspect. The second aspect is that if you have a diabetic person at home and you do not have diabetes with God's grace, and you are having sweets and savories and mangoes and chikus, how do you expect the poor fellow not to have them? Is it not your responsibility? So, and by the way, are the sweets or fats healthy anyways? So, if you have someone who has diabetes, you should encourage him and avoid those foods which he is not allowed, so that number one, he is not demoralized, and number two, you don't get diabetes yourself. Exercise. If he can't hit the gym, where's the problem if you go for long walks with him? Long walks, or walks for that matter, will serve two purposes. Number one, burn the calories. And number two, most importantly, it will build up a camaraderie between the two. In this era of nuclear family, loneliness and depression itself can precipitate and worsen diabetes. So just by simple walking, you are doing two things that are so important. And you should look at the cookery book and make good things which the patient with diabetes can have. Now, what about the gifts for a diabetic person? On his birthday, gift him a pedometer. On his birthday, gift him a beautiful, attractive bag which has ample spots or spaces for the glucometer, for the candies, for his documents. Give him a CD player. And mind you, music is a very, very good stress buster. I'm not diabetic, but I myself have so much of passion for my music. I just don't go in my car without my music system in place. And music is a very good stress buster. And the music can be his choice. It can be Hindi, filmi, classical, Sufiana, bhajans, whatever. Stress worsens diabetes. We have to understand that, and whatever mechanisms we employ to de-stress the patient is welcome. It's very, very good. Type 1 diabetes, type 1 which the children have. Not very common, but we endocrinologists do encounter them. It's mother's nature that if the child suffers, she's upset. The diagnosis of type 1 diabetes comes as a bolt from the blue. It's immense denial. People are not willing to accept. And on top of that, tablets don't work, only insulin. And the myth, it's painful, it's bad, it's dangerous. That only worsens the matters. So, what do we do? Number one, and I'm saying this with experience, if someone of you has a child who has type 1 diabetes, don't take it otherwise, but it's a practical situation. Either the type 1 diabetes child, which is the usual scenario, be pampered, or sometimes maybe ridiculed, but ridiculed is very, very rare. And both are wrong. Obviously, if you ridicule a child, you know, sugars will worsen and the child. But if you pamper him, the child in due course of time, 6 months, 1 year, 3 years, will use his diabetes as a shield. And that should not be the case. So you should give equal affection to all the siblings, diabetes or not diabetes. A diabetes prone child, diabetic patient child has no business to say, I have diabetes, I could not perform well in academics. He has no reason to say, I could not perform in the co-curricular because I have diabetes. No. Type 1 diabetes does not hinder your learning capacities. It does not. So, suffice to say, it is not a small term. Family is family. And we have to look after the diabetic patient in the family with equal vigor as we would look after ourselves. And we could be, in the coming years, the diabetes capital of the world. Let us strive to make India the diabetes control capital of the world. Together we can de-diabetes India. Together we will de-diabetes India. Let's take it a pledge. Jai Hind.